So hello everyone. Thank you all for coming. This presentation is about urinary incontinence in women. We will be talking about different causes, risk factors, and treatment options for urinary incontinence in women, specifically stress incontinence and urge incontinence. All right. So now let me introduce myself. My name is Alina Garaeva. I'm a nurse practitioner provider at Alderman Center. I've been in healthcare for over 10 years. And at the Alderman Center, we specialize in urology. We treat patients with various urological conditions, including urinary incontinence and even cancer, like bladder cancer, kidney cancer, and such. So we work with women and men. At Alderman Center, we speak 3 languages: English, Russian, and Lithuanian. Dr. Elterman, you see that's his picture, Dr. Elterman. So he is the lead urologist, and he's well known in this country. He's been practicing over 20 years, and he's been taking care of patients with urological conditions. He does surgeries, and he was also a teaching doctor. He was an assistant professor at Rush University, teaching medical students for many, many, many years. Okay. So this slide talks about what is urinary incontinence. Well, it is an involuntary leakage of urine. And it is a pretty common condition. Actually, over 50% of patients experience urinary incontinence, and is associated a lot with age. Yes. So, and is often undertreated. Unfortunately, women feel reluctant to talk about to talk to their doctors about the urinary incontinence because maybe they feel a little bit embarrassed, or maybe they just don't know that it's a treatable condition. Plus, there are so many options available for the treatment of these conditions. This is the good news. Another good news is nobody dies from urinary incontinence. Obviously, it's a good thing, but it can give you a great deal of discomfort. It affects your quality of life, and sometimes cause a little bit of health issues. It can cause like depression, anxiety, work issues, have trouble with travel or sexual interaction with your partner. From constant moisture and skin irritation, you might develop some skin infections. It also can cause some problems with your kidneys if incontinence is caused by chronic urinary retention, that when the urine backs up into the kidneys. It can also cause some falls and fractures when you try to get to the bathroom real quick and you trip and fall. So this is a big one. Okay. And of course, it is a treatable condition. We can well manage it with the treatment options. Okay. So now let's talk about the risk factors. So we have some big risk factors. Age is a big one, of course. Over 50% of patients with urinary incontinence are over 60 years old. Weight gain or increased weight, definitely extra weight puts extra pressure on the bladder. Childbirth, pregnancies, and also pelvic floor surgeries that they can damage pelvic floor muscle, weaken it, and which may lead to urinary incontinence. Family history, those patients who have their mothers or grandmothers suffer from urinary incontinence can also develop that. Smoking and certain medical problems, age-related, especially like diabetes, stroke, pelvic radiations, they can all lead to urinary incontinence. So there are many different types of urinary incontinence. I mentioned 5 here: stress incontinence, urgency, and mixed are the most common ones. We also have neurogenic and overflow incontinence. So assessment. As you can see, there are so many different types of urinary incontinence. So it's very, very important for us to have a good assessment to differentiate between different types of urinary incontinence, because the treatment options are different for different types of urinary incontinence. So at the Elgerman Center, we do a thorough medical history. We look at your medications, at your surgical history. Those can lead or cause or worsen your urinary incontinence. We also check your urine for infection or for traces of blood. We perform physical exam. Especially, we look at your pelvic organs, and we do the rectal exam, or pelvic exam, rule out we try to look if you have any prolapses or any anatomical abnormalities. Voiding diary, we ask you to complete a voiding diary and give us some information on a questionnaire. What is the most bothersome symptom for you? Because we want to treat something that is most bothersome. And if it's not bothersome to you, we don't want to touch it. What else? We have the post-void residual. We check that when you go to the bathroom, you void, and then you come back with the ultrasound. We do a quick post-void residual assessment, which tells us if you have, if you're retaining urine, and that causes incontinence. And urodynamic study is the big one. We can actually scientifically assess the bladder function or urethral function. So this test tells us a lot and differentiate between different types of incontinence, can help us guide our treatment. So all of this assessments are important. Now let's talk about stress incontinence. So what is stress incontinence? I'm sure all of us can relate to that, especially everyone who have kids. Stress incontinence is involuntary leakage of urine when we put some pressure on the bladder, when we sneeze, cough, laugh, have sexual interaction, or jump. All of that can put extra pressure on our bladder, and we start to leak urine. It's very common in younger women. It can develop in early 40s, so definitely can experience that at a younger age. And it's associated with childbirth, pelvic floor surgeries, especially hysterectomy. It's a big one, and pregnancies. So what causes stress incontinence? So basically, it's the problem with the pelvic floor muscles. As you can see on this picture, we have a good muscle, nice and strong, and here's this muscle is sagging. And when the pelvic floor muscle weakens, it sags, and it puts lots of pressure on our bladder and urethra, making them work so hard that they weaken, and it causes dysfunction and leakage. Well, the treatment options. So we have lots of treatment options for stress incontinence. Of course, we always want you to start with the least invasive ones, like weight loss. Losing a few pounds can actually greatly improve your stress incontinence. Fluid management, we don't want you to stop drinking water. Definitely, it can cause dehydration, not good. But we want you to maybe sip small amounts of water throughout the day. instead of drinking large glass of water, also avoid bladder irritants like caffeine, tea, coffee, alcohol, soda. They can all irritate the bladder and cause urinary incontinence. Treat constipation is a big one. You kind of don't think that constipation can cause incontinence, but actually it can. Chronic constipation puts pressure in your bladder and also weakens it. So definitely control your bowel movements. Quitting smoking. Smoking is associated with coughing. The more you cough, the more you leak. So, and you can also do the Kegel exercises. We mentioned that earlier, Kegel exercises. It strengthens the pelvic floor muscle, make it more stronger. Like this is a strong muscle and this is a weak muscle. And you can do it by some Kegel exercises. Sure, you might do some of them at home already, but I'm just going to mention how to do them correctly, because that's the muscle that you squeeze is important. So you squeeze the muscle that is in your pelvic area, so genital muscles, as if you're trying to stop the flow of urine or passing gas. So you squeeze those muscles and you count to 5 or 10 seconds, and then you relax. And then you squeeze it again, and then you relax. 10 squeezes 3 times a day. That's all you need to do. But you have to do it consistently every day. You train the muscle, yes.
Question on this. When you squeeze, are you breathing in or are you breathing out? Are you inhaling or exhaling?
Yeah. I don't think it's important. It's just as long as you are squeezing the muscle, that's all that matters. I don't think breathing can make a big difference. It's just important to squeeze the right muscle. Just like when you train your, I don't know, arms, and you just put weights on your arm. So yeah, those are like you squeeze. And Dr. Eltman always tells his patients to when you go to the bathroom, for instance, and you empty your bladder or you have a bowel movement, do some Kegel exercises while you're sitting on the toilet. That kind of a reminder for you to initiate Kegel exercises. So those are the yes, the Kegel. Yeah, this is can help you when you do the Kegel exercises, kind of squeeze those muscles, tighten those muscles. It might take 2 to 3 months to actually see the difference, although just like training any muscles, takes time. Other treatment options, estrogen cream. Lots of women are afraid of using estrogen cream, but this is actually a great option. As we age, we lose estrogen, and estrogen receptors are in our bladder, urethra, uterus, and it's great for great for keeping our muscles tight. It improves blood flow to the muscle, and also improves the vaginal flora, prevents you from having urinary tract infections. So using estrogen cream twice a week can also help you with some incontinence. Definitely one of the options. Pessaries. I'm not sure if someone has a pessary, but this is also great in helping you improve your stress incontinence, especially if you have pelvic organ prolapse. So pessary is a device that is placed inside your vagina, basically, and it kind of lifts, and it lifts the bladder and uterus and other pelvic organs, basically putting them in the right position. And unfortunately, there are no medications. We don't have any drugs available, because as you can see, stress incontinence is caused by just a weakened muscle. So there's no medications available for that. But there is a surgery called mid-urethral sling. So there's a surgery if you absolutely cannot tolerate the your stress incontinence if it just like you kind of move, stand up, and it just you have the leakage, great leakage. So you can elect to have that surgery done. And it's a very common procedure. It's been, Dr. Eltman can perform this procedure. It's minimally invasive. It is done under general anesthesia. It takes literally 30 to 45 minutes to have that procedure done. And it involves a very small incision in your vaginal area and putting in a sling that's kind of like this, that is placed behind the urethra, and it lifts up the bladder, provides supports to the urethra. And a high success rate, about 85% to 90% of success rate with this procedure. And now let's talk about urgent incontinence. There is also another type of incontinence, urgent incontinence. What is urgent incontinence? It is involuntary leakage of urine that is associated with urgency, with like a sudden, strong desire to void. It can be very, very uncomfortable for my patients. And it's another word for it is overactive bladder. Maybe you've heard about it. When you have urgency, urge-related incontinence, you have urinary frequency during the day and night. Wake up like 5 times at night to urinate. It is associated more with age. If stress incontinence is more in younger women, then this one is like after age 60. And it's also associated with some age-related comorbidities like diabetes. So what causes urgent incontinence? So the bladder is a muscle, but it also has nervous system that is attaches to your brain. So any dysfunction in the muscle of the bladder and any problems with the nervous system or any problems in the like a mucosa inside your bladder can cause overactivity of the bladder muscle. Some like diabetes, multiple sclerosis, Parkinson's disease is a big one. Any trauma to your spine or brain, like during some car accidents, or frequent urinary tract infections or interstitial cystitis, they can all cause this. So unfortunately. But there are some other things that can mimic overactive bladders. So this is not, that might be transient, like it comes and goes, but we need to rule that out. So that's why we check your urine for urinary tract infections each time, because bladder infection can mimic urgent incontinence. Maybe you have a bladder stone, maybe you have a bladder cancer, or maybe you have severe constipation. Pelvic prolapse can cause urgency because you cannot empty your bladder completely, and it's constantly irritated from having that urine in your bladder. Maybe you have as simple as atrophic vaginitis that we can correct with estrogen cream, or certain medications, a lot of it like Parkinson's medications, antipsychotic medications, and some blood pressure medications can actually cause that urgent incontinence, temporary urgent incontinence. So what are the treatment options? The treatment options, there are many actually. We always start with less invasive, with lifestyle modifications. Fluid management, just like we talked about with stress incontinence, sipping small amounts of fluids throughout the day. Timed voiding, try to void at the regular time, like every 2 hours, to avoid that urgency. And that's why you fill out the bladder, the voiding diary, that can help you to identify, oh, I have urgency every 3 hours, then you need to go to the bathroom every 2 hours to avoid that sensation, to empty your bladder completely. And you can do some bladder training. When you feel that sensation of urgency, you can stop it by telling your bladder to calm down. You perform those Kegel exercises, basically. but the quick one. Instead of counting to 5, 10 seconds, you'll do the quick flicks. That's what I call quick flicks. Like squeeze, relax, squeeze, relax. And that can relax your bladder and stop the urgency. So those are the lifestyle modifications. And there are a bunch of medications. Oxybutynin and myrbetriq are the most common ones. Tolterodine, Gemtesa, Vesicare, so many ones, so many medications. So with the medications work on the bladder muscle. So it calms the bladder, stops it from being so overactive, reduces the extra contractions. It can be the pill form or patches, so different options. If you can swallow the medication, you can use the patch, and Oxytrol is one that you can buy over the counter. Side effects. Everyone is afraid of the side effects. Dry mouth, dry eyes, constipation. Those are the bothersome ones, but they're not going to kill you. They can cause a little bit of dizziness, maybe some confusion. There are some medications in this group can cause confusion or worsen the dementia, like oxybutynin. But there are others that do not cross the barrier, and they do not cause the confusion. So I will always try to kind of prescribe the ones that are least, that has the least side effect profile, like myrbetriq, Gemtesa, trospium are the great ones. Second line therapy, if you cannot tolerate the side effects of the medications, or the medications just don't work. Maybe your problem is not in the bladder muscle, but maybe it's the nervous system. So you can do the tibial nerve stimulation. It's a simple procedure that is done in the office. It's like an acupuncture type of procedure where we put an acupuncture type needle around your ankle, and we attach it to the small device that gives some mild electrical stimulation to the tibial nerve. 30-minute sessions once a week for 12 weeks. You just have to complete those 12 weeks because to have a good response to it. And a lot of patients like this. And some patients just do the tibial nerve stimulation. Some patients have the combination of medications and tibial nerve stimulations, especially those with Parkinson's disease or diabetes. They have kind of both issues with the muscles and nerves. So this is a nice option for those ladies who don't like the medications. The third line treatment, definitely we have those for very severe and complex cases. There is a sacral nerve stimulation, and there is a Botox injection. Sacral nerve stimulation is just like a tibial nerve stimulation, but there is a permanent implantable device that stimulates your bladder constantly. So basically hits the sacral nerve. It does not stimulate the sacral nerve, that stimulates the bladder, calms it down. Also minimally invasive. It involves a placement, a tiny little device underneath your skin. So think of it as there is a pacemaker for your heart and there's a pacemaker for your bladder. So it's the same kind of idea. It lasts 15 years and works well, at least for the patients that we have. Like 80% see a huge difference and improvement of their urgent incontinence. And there's also with this treatment, it kind of treats both bowel incontinence and urinary incontinence. If you have both, it actually can help you. And Botox injections, as you can see, maybe you've heard about it. It's a very traditional way of treatment of urinary incontinence. It's basically injecting Botox inside your bladder with a cystoscope, with a small catheter-like device. Just like we do Botox on our face, this is Botox in the bladder. So it kind of calms the bladder down, blocks those components that overreact, that makes our bladder overreactive. This is an office procedure done once or twice a year. No special preparation for that. And this is my last slide. I just want to touch up on other types of incontinence real quick. So we talked about stress incontinence, which is mostly related to the muscle, and urge incontinence related to the dysfunction in the bladder and nerves and the lining of the bladder, so multiple issues. Mixed incontinence is both. Many patients actually have both. They have stress and urge incontinence, and we treat both in the situation, or treat the most bothersome symptom. And we have neurogenic incontinence. This is mostly with occurs in patients who have neurogenic problems like stroke, spinal cord injuries, multiple sclerosis. It actually has urinary retention and incontinence at the same time. It's really kind of tricky to treat. And overflow incontinence is when your bladder is not emptying completely. It can be due to weak bladder, just as simply the bladder fails to squeeze the urine, or there is an obstruction that can be corrected, like prolapse. Maybe there is a bladder neck mass or urethral strictures. Those we can correct and help with urination. So you kind of have, with overflow incontinence, you have constant dribbling of urine throughout the day, and you feel that sensation of heaviness in your bladder, not emptying it completely type. So yeah. So as you can see, there are so many kinds of urinary incontinence. They all have different causes and different treatment options. And it's very important to identify which one you have in order to have the right treatment. So thank you. If you have questions, I will answer them. Go ahead.
How often do you send people to physical therapy? Is that usually?
Oh, great question. I actually like my patients to go to the physical therapy, especially if they tried Kegel exercises. I teach them, and they just can't perform them right, or they don't feel they're helping. I would love, yes, and we send the patients to physical therapy, or I can send the patients to physical therapy if they wish right away, because that can improve your symptoms greatly, definitely. And we have a few nice physical therapists in this community.
So
if possible, it's here.
Huh?
If possible, it's here.
Oh, physical therapy? Do we have physical therapy here, like in this building? No, there's one in Weiss Hospital. There's a great physical therapy at Weiss Hospital, at Weiss госпитале, недалеко отсюда.
But you don't have to come to Weiss as long as you get physical therapy. I said, you don't have to come to Weiss as long as you go for physical therapy somewhere.
I don't use this hospital.
She's in hospital. Well, есть другие места, где можно, ну вот рядышком есть другие места, где можно делать терапию. Okay.
I think most hospitals' physical therapy departments have this.
Yes, it's a pelvic floor physical therapy, basically. Yes, there are so many of them right now.
So a friend who's in her late 50s wrote me and asked me about, oddly enough, this morning. She did not know I was coming to this. She said, have you heard of pelvic floor EMS, electrical muscle stimulation?
Yes, and that's.
So is that what you were talking about before for neurological? Because
Oh, it's a little different. So this is done at the physical therapy. So that's why it's nice for you to go to physical therapy, because the physical therapists not only teach you how to do Kegel exercises at home, but they do a lot of other things. They thoroughly assess the pelvic floor muscle. They look at some issues where there's weakness, where there's tightness, and they do the massages, or with electrical activities. They also have that, but this tibial nerve stimulation is a little different.
okay.
but definitely they have lots of options to improve your pelvic floor muscle.
Is that usually, do you put more of an emphasis on that before you go to the route of medication? Or
Oh, yes, for sure. We always want you to try Kegel exercises with the stress incontinence. It's only good for stress incontinence. Pelvic floor therapy, definitely. Yes, yes. Do that first. And if that fails, then we try other options. And it usually helps. 40% of patients see the improvement with pelvic floor therapy.
Okay, thank you.
Mm-hmm. No,
I'm
because
trying to keep the lights
Yes,
down.
yes,
That's why I'm dancing back here, so sorry.
no, that's perfect. Yes.
I had seen in a magazine,
Uh-huh.
this little, what they call it, Kegel exercise.
Uh-huh.
So I said, oh boy, I guess I better get that. So I did order one.
Mm-hmm.
And I can't say that it really worked because you know what?
Mhm.
When I would use it,
Uh-huh.
then of course I'd want to clean it and then put it away until
Uh-huh.
the next time I'm going to use it.
Mhm.
And so that started to be a problem. But I'm sorry.
Like you're trying to little ball.
No, it looks like a little miniature saddle that you put, right.
There are
up to-
different kinds of now.
Oh, okay. Well, this
Uh-huh.
one was like, it looked as though it was a miniature saddle that you put at the
Mhm.
beginning of your thighs.
Yes.
And then you would squeeze them and et cetera, et cetera. But I did notice this,
Mhm.
like I'm now
Uh-huh.
very, anyway, I'm not gonna say that out loud. But I found that as long as I was a exerciser,
Mhm.
I didn't have that problem. But like with the last couple of years, when everything is, because of the pandemic, everything slowed down. I didn't, do as many exercises or whatever. I found that I started to have that problem with incontinence. And so I think that maybe if we would continue to exercise, different types of exercise, as long as we could do them, seeing that it helps with that. Now, I do take a high blood pressure medication, which is a, what do you call it?
Which one?
HCTZ, which is a,
Hydrochlorothiazide.
yeah, and that's can't say it right now, it's not coming
Yes.
in my mouth. It's a-
Diuretic.
right,
Yeah,
it's
mild.
a diuretic.
Mild
So,
diuretic water pill.
it's not really a problem, as you
Mhm.
say, as long as because I would drink water all day, but I would sip it.
Mhm.
And so I never had a problem with having to run to the bathroom.
Mhm.
But now I know that when I feel that first inkling
Uh-huh.
that I do need to go, then I go ahead and I don't have much of a problem.
Okay. Yes. So, and again, women don't die from urinary incontinence as long as it's something that you can tolerate and manage in a way that it's not bothersome to you and it does not affect your quality of life. Then we prefer not to do anything about it. But those exercises are great, and you have to be consistent with them. You have to do them every day, just like with any exercises of any of your muscle group. If you stop doing them, then it just goes back to baseline. Mhm.
But you don't get any kind of device to do keyboard.
You don't need. You can just learn them. But the device can help you to kind of. It gives you a feedback, like you squeezing the right muscles, and you working it. You work the right muscles. So it kind of gives you a kind of feedback, just like with the ball you put inside the vaginal canal. Kind of, if it's squeezing and the ball is squeezing, you kind of know, okay, I'm doing it right. Kind of just for your understanding whether you're doing it right or not. But Kegel exercises, not necessarily. There are some on YouTube. There are some options how to do them. Like you said, like at the gym, working with the pelvic floor muscles. There are some other options. There are just different types of Kegel floor exercises. I just gave you the quick and easy one. Mhm. Any questions? У вас есть вопросы?
Do you know if Medicare pays for the physical therapy?
Yes, yes, it does, actually, Medicare. We send patients to physical floor therapy and it does cover like a
Would
certain
Medicaid
numbers.
cover it?
Medicaid, some Medicaid, and they're just not, you just have to find the physical therapist who takes Medicaid, but it does cover it. Because we give you the referral. Mhm.
So, sorry, billing seems to be, billing at Weiss Hospital seems to be a big problem for a lot of my residents that I work with. In that you have a lot of third-party
Oh, true.
providers. Does that mean that your physical therapists are also third-party providers? Like when you said that you need to find a physical therapist that will accept it?
Judy?
Our physical therapy team would accept it. We accept Medicare, Medicaid, and pretty much all insurances. If you have a managed care like a PPO or an HMO, you do have to get a referral authorization from the insurance company. And one of the issues that we had was recently we switched over to EMR, the medical records, the electronic medical records. And so we also went to another billing company. And in the process of transferring over those files, a lot of the insurance information was lost. So it's very simple, like if you get a bill, you just contact our billing office, share with them their billing information, especially Medicare. For some reason, the Medicare information did not transfer over. And that really bothers the senior population, targets the senior population. But if you ever get a bill and it shows that you owe something, and you can suggest this to your residents, just call the billing office and give them the Medicare information or Medicaid or the other insurance. I found that that's what when patients have received billing, received bills, our insurance biller, as our accounting area has not received, doesn't have the information on file. And saying that, there was also just recently released from the state is that because of the COVID lapse where everything was just shut down, it's important for you to contact your agencies, your insurance agency, Medicare, Medicaid, to make sure that your information is up to date and correct. Because so much has happened over the past 2 years. And there was no contact pretty much for 2 years. So you had people working at home that weren't really working in the office, where you have your computer and you were putting in the information constantly. So, that's going to be coming about. So that's going to be another big issue.
Very helpful. Thank you.
Good, yeah.
So if somebody isn't with Weiss,
Mhm.
would they just ask their primary care physician to refer them to a urologist, or who would they ask for a referral? Because most general practitioners
Mhm.
aren't experts at it.
Mhm.
And I would think if you're going to go through the whole screening process, you'd want to go to an expert.
For sure.
Because a primary care physician, I think, would be more likely to just prescribe Novetric or something
Yeah,
just to
sure.
see it, instead of going through the logical steps that
Mhm. Mhm.
a urologist would do.
Right, and at Elderman Center, we take all the insurances, all kinds of insurances. So we accept them all. Yes, and even with Novetric, one of other side effects is that it can cause urinary retention, and without knowing it, you might have that problem developed. And at each visit, we check post-void residual just to make sure you're not retaining urine, because that's a whole another problem. You cannot take medications if you have urinary retention.
But I mean, you have this center that deals with this. So I'm just saying,
Yes.
if you're with a different insurance or you have your healthcare elsewhere,
Mhm.
would you suggest that somebody ask for a urologist?
Oh, yes,
instead of trying to
absolutely.
deal with the primary care?
Yes, you can definitely try the medication through primary care physician. And if that fails or something goes wrong, side effects, then you should see the urologist.
Can she contact a urologist directly without going through a primary care?
Depends on
Well,
your
it depends on your
insurance.
insurance. If you need a referral, if you should have HMO, but you can see the urologist. Because urologist kind of goes deeply into the problem. But if it's something mild, so you can try the medication. If that works greatly for you, great. If not, then see the urologist. Maybe you have something else more than just simple problem. Mhm. And our office is located in Skokie and at Weiss Hospital, and Dr. Elterman works at Advocate and at Weiss. Any questions? No?
Thank you.
Yes. Thank you. Thank you.